Welcome to the Best Health Radio Show. And boy, that is the goal of 2021, for us to achieve and maintain best health. While the planet is somewhat shocked and paralyzed by fear of this pandemic. So I have something very interesting to share with you about how today unfolded that addresses health, fear, pandemic, all of that. So it's been a glorious Sunday in Austin, Texas, just glorious. And my longtime friends, Neil and Jennifer, raise much of their own food at home, and they wanted me to come over to their home to have a socially distanced lunch. They even set me at my own little table in the patio where they gather all the food right from their garden. He takes their table scraps, mix it with leaves, makes compost, raises food, picks the food from the garden, cooks it, and that's what they serve on the plate. I asked him why I wasn't going to be able to sit in the house because they're all fine and they've been mindful. I'm fine. I've been mindful. And Neil said, we're respecting the wishes of our son. He is getting certified as an EMT, and he is very nervous about going back and finishing his tests, which they cut short because one of the students got COVID and they all have to take this test together. So we're honoring him, even though we're not really that frightened of COVID anymore. We want to honor him. And in fact, our daughter, who works in upstate New York for NPR locally there in the radio station, is also pretty fearful of COVID. So even though we feel that we know enough to do to protect ourselves from COVID, our two children don't feel that way. They've adopted this cultural mindset of fear about the pandemic. So we're honoring them. So we sat outside, and that got me to talking about COVID versus fear. What's the reality? And some conversations about our children. And at the end of the show, we're going to talk about some unknown and unappreciated roles of estrogen in the immune system and how hormones keep you healthier longer and fighting viruses better. So in the beginning of the pandemic, I, like most people, didn't know that much about it, and we didn't understand how to approach it, and there has been a lot of paralyzing fear around it. But recently, there have been quite a bit of information based in science of the compilation of supplements and low-cost medications that in peer-reviewed data are efficacious against COVID. So much so that before I did the show, I called up the docs at my clinic at the Naples Center for Functional Medicine and asked, how many patients have we treated via telemedicine? They didn't come into the clinic for COVID. And who got hospitalized? What was successful? What did we do? So far, our clinic has treated about 70 patients with COVID. We have an older demographic, a more vulnerable demographic. That's what everybody's saying, right? The senior citizens are the more vulnerable demographic. The majority of patients have been treated with hydroxychloroquine, which the Marseille study out of France early on in March had done a variety of studies showing that patients that took hydroxychloroquine along with the ionophore, Zithromax, and zinc, compared to patients who didn't take that, had a 95% viral load by the end of the first week. That's what came out of France early on, and I wrote about that in my free blog at drlindseybergson.com in the blog section. So early on, our patients were given hydroxychloroquine and a medley of supplements that have been shown, and that's also in that article for free that everyone can go to, a medley of supplements that have been shown to boost immunity and block viral replication and be efficacious. Recently, the clinic has also been utilizing a medication that has been presented by an alliance of COVID frontline emergency doctors. And that medicine shall not be named because I presented on Facebook a meta-analysis of 28 studies showing efficacy, and 10 of those studies were randomized controlled, placebo-controlled trials. Just giving the link to that meta-analysis is taking a look at a clump of studies to see the trend of the outcome. And Facebook sent me a note and said, if you publish anything like this again, we're going to shut you down. So in our clinic, the first 65, 67, 68 patients with COVID were treated with hydroxychloroquine and supplements. And all of them got better very rapidly. None of them were hospitalized. All of them were older. Some of them were extremely ill. And usually by the fourth day, they were extremely improved. The last few patients, the nutrient medley has been mixed with the drug that shall not be named. I asked Dr. Brownstein, what do you think of hydroxychloroquine and the drug that should not be named? And he said, I use natural interventions, which is the medley of supplements along with IV vitamin C and a number of other IVs. And I don't even need to go to the pharmaceutical interventions. And I have now published that data in a medical journal, and I have a book coming out, and he's going to come on the show and talk to us about the book on how to protect your immune system against a virus. But the point of it is, if we have these natural interventions that are inexpensive and relatively safe, then how fearful should we be? And also, the real big point is that how ill America has been becoming. As of today, there's about 358,000 Americans who have died from COVID. It is a flashing red light that our culture is ill. And I had Dr. Leo Galland on the show earlier on, and he said, it's not like you can just take these supplements on day 1, 2, and 3 and suddenly have great tissue levels. It really bespeaks of a lifetime of positive habits that accrues and fills piggy banks in your tissue reservoirs, where you accumulate all these good polyphenolic compounds in your tissues, and then that protects you. So then I decided, well, I wonder how many people who've been living the way that we all talk about, eating a colorful rainbow type diet and taking supplements like quercetin and zinc and melatonin and vitamin D and vitamin A and N-acetylcysteine, taking these supplements on a regular basis, how many people get COVID who have been living a life where they take these supplements on a regular basis? So I went about the last few weeks writing all the colleagues that I knew, saying, do you know anybody? I mean, early on, there were colleagues and friends that I know that weren't on these supplements that got COVID. We didn't know a lot about it. And some of them have got very ill and are still ill. But I asked my colleagues, do you know anyone who lives this way and has lived this way for a while that got COVID? I've been living this way for many years. So most of my colleagues said they don't know anyone who takes these supplements on a regular basis, who have ongoing, and as a lifestyle, taking these supplements on a regular basis and gotten ill. Finally, one person wrote back that they knew one friend that got COVID who takes these supplements on a regular basis, but they didn't get very extremely ill. But out of asking about 25 colleagues, which I don't know the umbrella that would spread out over, of hundreds and hundreds of patients, most of them who live and take and eat a great diet and maintain a healthy immune system, so we don't have this sense of learned helplessness where we're just fragile, vulnerable victims to this virus and there's nothing that we can do, that really have gotten ill, except one. One colleague wrote back that one person that they knew who lived like this had gotten ill. Now that's out of hundreds and hundreds. So I was chatting about this with Neil and Jennifer, and I said, it's such a complicated time to know who to believe, because why isn't there within the public dialogue a discussion about how to protect our immune system deep within so we don't get at risk of this, and things to do at home to keep it at bay so we don't end up in an ER or an ICU. Why is there no discussion on this? Why do we have to be like your son and daughter, so fearful of this that I'm sitting out here on this patio with you rather than inside the house, even though all of us know each other so long and we're so mindful? So I wanted to share with you this testimony of Pierre Corey. He's a medical doctor, and he gave this testimony in front of the Homeland Security Committee meeting. And it was called Focus on Early Treatment of COVID. He gave this December 8th, 2020. So that's less than a month ago. And I think this is so important. He said, I want to begin by thanking Senator Johnson and the committee for this critically needed effort to bring attention to the importance and need for effective early treatment approaches to COVID-19. I'm speaking today not only as an individual physician, but also on behalf of my nonprofit organization, the Frontline COVID Critical Care Alliance, of whom I have had several of these physicians on my show, made up of some of the most highly published and well-known critical care experts in the world, with almost 2,000 peer-reviewed publications in the medical literature. And of course, that's the holy grail of science, peer review, as well as over 100 years of bedside clinical experience in ICUs around the country. Although we, says Pierre Corey to Congress, basically, although we, like many, are extremely encouraged by the apparent success in developing effective vaccines, we are also, and this is the point to make, dismayed. I am so with him here, dismayed at the near complete absence of guidance and research on effective early, at home, or preventative treatment options apart from vaccines, a reality we find unconscionable. I find this unconscionable. Why can't you, if you start feeling ill, think of some things to do? And why aren't you doing some things right now? And why isn't there this public cultural dialogue from our experts guiding us in this way so we all just don't buy into this learned helplessness and fear? So much so that Neil and Jennifer's son and daughter were just paralyzed, and I'm sitting out in the patio. So our hospitals are overflowing, says Dr. Corey, with over 100,000 COVID patients admitted. That was December 8th, 2019. And new record deaths are reported each passing day. It will take months for the vaccine to be distributed to the general public and further time to have sufficient impact in this crisis. So we are here to stress the need for effective early treatment. This is the deal, folks. Effective early treatment. We should have this in our pharmas, in our cabinets. My organization, says Dr. Carey, of critical care specialists have spent almost 9 months since the pandemic hit, tirelessly reviewing the scientific literature to gain insight into this virus and the disease process to develop effective treatment protocols. All the while, we're working long hours in intensive care units full of COVID patients. I was proud to testify in front of the committee about our Math Plus hospital treatment protocol in May. I was interviewing these guys in April, which I would like to mention has had nearly every single component of its combination therapies validated in clinical studies, meaning every single part of what they're recommending had a clinical study to validate the use of it for viral infections. And our paper detailing and reporting on the impacts of the treatment protocol will be published within days in the Journal of Critical Care Medicine. And so it is with great pride as well as significant optimism that I'm here to report that our group, led by Dr. Paul E. Merrick, an amazing human being, a genius really, has developed a highly effective protocol for preventing and very early treatment of COVID-19. This is done he made this presentation in an hour-long presentation to Congress. In the past 3 to 4 months, emerging publications provide conclusive, that's what you hear, right? Conclusive data on the profound efficacy of the anti-parasitic, antiviral drug, anti-inflammatory agent called the drug that cannot be named. I cannot name this. I don't want the FTC to remove all my podcasts in all stages of the disease. Why should this be removed? Why should there be censorship on these? We're not talking Aunt Polly's snake oil here. We're not talking about a pendulum or muscle testing here. He goes on Our protocol was created only recently after we identified these data. Nearly all studies are demonstrating the therapeutic potency and safety of the drug that shall not be named in preventing transmission and progression of illness in nearly all who take the drug. So I wrote the physician in our clinic who's doing the telemedicine with COVID, because we don't have the COVID patients come into the clinic because that would contaminate the whole clinic, and said, how many people do you think that you have worked with? He said, 70. Have you had anybody go to the hospital, have to be hospitalized? No, no one. Have all been improved? All. What's the average age? Mid-70s. How sick were they when you started working with them? Some vary. How long did it take to have response? Usually a few days to a week. Now, this is what's happening, and we have 358,000 plus people dying. Our ICUs are maxed out, and we're leaning on protocols that are not efficacious. The CDC, one of my neighbors, my close neighbors, their mother went into the hospital 2 days ago with COVID, and I said, ask the doctor for this drug that shall not be named. And the CDC has now said, do not use this drug. What is going on? At least we need to be awakened to the fact that we are an ill nation. We need to be awakened to the fact that the way that we live and the habits lifelong that we accumulate affect our response and vulnerability to viruses. So start living healthfully now. It is a wake-up call, so wake up. But why not, if you get ill, do an earlier intervention that's inexpensive and has peer-reviewed data behind it and has so much efficacy and success behind it before you just allow yourself to get extremely ill? And who knows what happens once you get into the ICU. God forbid you need to be intubated. And who knows what role genetics play to get that S spike protein easily attaching to your ACE receptors. So there is some vulnerability genetically. So some people are really going to need more help early on than not. And wouldn't it be nice if it was just there in your medicine cabinet? But because I know all these things, I'm not as frightened as I was at the beginning of the pandemic. And I would have been okay if I went inside the house with Jennifer and Neil and their son and their daughter. So they were sitting back and saying, isn't it amazing that we feel with the way that we've eaten, we're pulling food out of their garden. They're people that have been raising their own food for years. They have their own organic cows on a farm that they share with a bunch of other families that was partially arranged from the family practice clinic that I worked at, the Wiseman Family Practice Clinic here in Austin, and a number of people get together and kind of co-own these organic cows together, and they make their own kefir and chocolate puddings out of avocado and seeds, and this is how they live. So they're feeling like they're going to do pretty well, but their children, they said, isn't it amazing that our kids just don't see things the way we see them? And Jennifer said, our kids are not ours. They're not ours. They are who they are, not who we would like them to be. And she said, there's a prophet that wrote this incredible poem that I want to read to you. So she ran upstairs and got the book that I remember from long ago, but I didn't really remember this poem. And I thought this was so deep and delicious. That Italian word comes to mind for delicious, esquisito. And it's by Kahlil Gibran, who was a poet from 1883 to 1931. So he was gone before I came on the planetary scene. And the poem was called On Children. And I thought it was so sophisticated of Jennifer to not be rattled by her children not adopting her world life viewpoint, but honoring their viewpoint. Thus, we were sitting on the patio. So here's this poem, and I think it's quite extraordinary. Maybe I wouldn't be who I am if my mother had read this poem and was able to take it in, although I doubt she would have been able to take it in. She always wanted me to be her. That was the deal. So the poem goes like this. And a woman who held a babe against her bosom said, "Speak to us of children." And he said, "Your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you. They come through you, but not from you. They come through you, but not from you." That is just the essence. And though they are with you, yet they belong not to you. You may give them your love, but not your thoughts, for they have their own thoughts. You may house their bodies, but not their souls, for their souls dwell in the house of tomorrow, which you cannot visit, not even in your dreams. You may strive to be like them, but seek not to make them like you. Oh my God, I wish my mother could hear me now. You may strive to be like them, but seek not to make them like you. For life goes not backward, nor tarries with yesterday. You are the bows from which your children are living arrows are sent forth. The archer sees the mark upon the path of the infinite, and he bends you with his might, that his arrows may go swift and far. Let your bending in the archer's hand be for gladness, for even as he loves the arrow that flies, so he loves also the bow that is stable. So Jennifer, in all of her wisdom, she's really a sage woman. She said, "My children came through me, but they're not me, and their thoughts are my own. Their thoughts are the future. My thoughts are the past." So they're letting their children move through this pandemic in the way that they will, own their own experiences that they have, and fed me on the patio. I thought that was phenomenal, and I thought I would share that with you, because we can never be reminded enough that to have interface with another human being is such a gift, if it's for a day, if it's for a few years, if it's for a lifetime. But we don't own this other person. We can't make this other person see the world through our own world life viewpoint. We have to honor each other's world life viewpoints and ponder the other viewpoint, enrich each other's viewpoint. And why can't we do this with COVID? Why can't we have multiple viewpoints with COVID? Why has there only to be the way the government dictates health to be and treatment to be and censorship to be? Too much regulation. People think they're protecting themselves with more and more regulation. You're strangulating yourself with more and more regulation and tighter and narrower standard of care, only set up for litigious benefits so that you could sue a doc that isn't performing standard of care. It's all so backward. It's really just backward. The world itself, it's, I guess the heaven is maybe a place where the world isn't so backward. I don't know about all that, but I do know that your perception is either your freedom or your prison. And it's the same in healthcare. Our perception is our freedom or our prison. So if you felt like you had ways to protect yourself, so when I'm going to travel tomorrow to Florida, I have a ritual. And I wear a surgical mask and then a cloth mask over that, and then a neck gaiter mask. And then I use colloidal silver that I spray every time I want to lift the mask up to have a glass of water, or I'm in line in the walkway to enter the plane. And I have goggles to seal my eyes from the potential aerosol droplets in the bathroom. And I'm taking the drug that shall not be named before I go on the plane. And I take every day this litany of the same nutrients that are mentioned by Dr. Corey impassionately to Congress. I've been taking them regularly. They are part of my being grounded in health. There's no guarantees in health, but boy, you can certainly do a set of actions that give you a better propensity for the outcome that you're aiming for. It's just, life is extraordinary, isn't it? It is a gift. But do we want to be confined more or live out loud more? Safely, but we should be able to choose and see each other's choices and be given and allowed a variety of choices. Our children, us and our doctors, us and our healthcare. So let's take us now to estrogen and hormones, because it's so interesting that we think of estrogen replacement as something to use when you're in your peri to postmenopausal years and you're having hot flashes and vaginal dryness, but it has a lot to do with your immunity. In fact, I've done even an entire show on how estrogen improves immunity, and there's several studies on COVID. That's why men seem to be more at risk of contracting COVID, and they seem to have more adverse outcomes with COVID, because estrogen is a big immune system regulator, modulator, and protector. You don't want to go off your hormone replacement, whether it's synthetic or bioidentical at this time. And you certainly want to appreciate the role of hormones in our overall health, much bigger than just getting rid of hot flashes and that dry Miss Puss down there. You really want to take a look at hormones as part of your bigger tapestry of keeping you well, even as you move through a world potentially fearful with COVID. So I wanted to bring up some interesting facts about estrogen and progesterone. Hormones have a lot to do with how we look at the world and our fear. So right now, a lot of people are paralyzed by this pandemic and this sense that we are vulnerable and small and weak. We've accepted a learned helplessness of our position on the planet with this pandemic. Interestingly enough, progesterone helps regulate and extinguish fear. This was a study that came out in Neuropsychopharmacology in 2016, and it's called Estradiol and Progesterone Have Opposing Roles in the Regulation of Fear Extinction. It was an animal study. It wasn't a human study, but what they were able to show is that progesterone calms the nervous system, regulates the nervous system so you feel more all right with your world. Sometimes we give progesterone to males. Progesterone is made in young males and females in their 30s and 40s right inside the brain to calm the brain, to keep you more on your game, more in your center. Are you a lawyer that's going to be fighting a case? Are you a mom that's going to be taking care of a brood of kids? Are you a doctor that has a huge busy schedule of the day? When progesterone is released and secreted inside your brain, and it's also secreted inside the chambers of your heart, it helps you stay more congruent and zen-like throughout the tasks that you have to be called on to do. It helps keep your heart more brave, more brave heart. I don't want to say Mel Gibson-esque, because nay, he didn't like Jews, and I don't want to talk about him, but I did like that movie. And it has a lot to do, the reason it's secreted in these areas is that progesterone as a hormone has a lot to do with keeping you more right with your world. So one of the posts that I put on Facebook on the last day of this year was progesterone as an anti-anxiety hormone. As we women get older and we ovulate less because our eggs are squirting out less, we mainly, not totally, but mainly make progesterone as we ovulate. So less ovulation, less progesterone, getting a little bit older, less progesterone. But at some gynecologic meetings these days, they've been presenting that the typical age of perimenopause is in the mid to late 40s, but some women are going earlier and earlier through perimenopause. We're even seeing some women in their later 20s and 30s going through perimenopause, and then they're not making enough progesterone. When you go through perimenopause, meaning you're making less, you're ovulating less, you're making less eggs. When you ovulate less, you make less progesterone. And by the way, you also make less oxytocin, because when an egg bursts out of the corpus luteum, it leaves a little scar. When an egg bursts, it leaves a scar, a yellow scar called a corpus luteum. And that corpus luteum produces two hormones that are intertwined together. It's progesterone and oxytocin. So you feel more right with your world with progesterone, and you feel even more and more right with your world with oxytocin. And as you ovulate less, you make less of those two hormones. And so it's easier to feel much more uptight and insecure and overwhelmed. And there's way too much on your bucket list and your daily list to do, and you don't know how you're going to get it all done. So hormones have a lot to do with facing this pandemic from a more grounded and comfortable space, so that you're not at the whim of the world and the frantic fear of the world, but you have more of a congruent center with which to interact with the world. And then, of course, we've all heard of the COVID-15, where people are gaining 15 pounds, or COVID-5, 5 pounds, 10 pounds. I don't really want to gain any weight. I gain 1 pound and I am not a happy camper. I don't have a very big frame. And gaining just a little itty bitty amount of weight does not a happy camper make me. And in this one very fascinating article, it came out in Peptides, 2001. In August, it's called Estriol cholecystokinin, which the acronym is CCK, and satiation. Well, one of the reasons that women gain weight as they get older and menopausal, and in the old textbooks, when I first went to school, they said the average woman in menopause gained 8 to 9 pounds. Now all those textbooks have been thrown out the window, because the average woman in menopause gains 20 to 25 pounds. And in COVID reality, yikes, the average woman, I don't know what she's gaining. I think it's going to be a lot. But it turns out that estrogen has a lot to do with making sure that you have better portion control. And it's long been known to inhibit feeding in animals, but we didn't understand why. Well, it turns out that there is a hormone that when it's released from the small intestine, it has a negative feedback signal control to the brain that you should stop eating, push yourself away from the table. Genug, my grandmother would say in Yiddish, enough. I've eaten enough. The end of the meal has arrived, and I'm okay with that. Too many Americans are not okay with that. Cholecystokinin is one of the hormones that makes you okay with pushing yourself more easily away from the table. It comes from the small intestine, but it's released in the presence of estrogen. So as women make less and less estrogen, they release less and less cholecystokinin, which the acronym is CCK, and it's spelled CHOLECYSTOKININ for those geeks out there, but just think of it as CCK. CCK. So estrogen helps your small intestine, after you eat, make more of the satiety hormone, CCK, which tells your brain, I've had enough. I'm okay. I can get away from the table. I don't need to eat out of control with little breadcrumbs all over my face, waking up in a food daze saying, oh my God, I ate a whole bag, which is partially due to not enough estrogen. Now, experimental manipulations of giving estrogen or giving CCK, cholecystokinin, and estrogen can cause animals to stop eating so much. They can modulate eating behavior and meal size by making sure that there's enough estrogen on board. And they know even the specific molecules. I don't know if I need to go through that on this show, but there's very specific molecules that when they give estrogen, which cause a release of CCK, even in animals who've had their ovaries removed, and that then tickles a part of the brain that then makes you feel all right with a smaller amount of food. For those geeks out there, those particular parts of the brain are the nucleus tractus solitarius, the paraventricular nucleus of the hypothalamus, and the central nucleus of the amygdala. I think that was kind of sexy to say all those polysyllabic scientific terms. So if any of you thought that that was really pretty sexy, you might consider calling me up. But anyway, what we do know is that estrogen exerts a biologically significant action on the satiety hormone. And so one of the benefits of estrogen replacement as you age is to help you have portion control management as you age. So don't just sit in that chair in front of the TV and eat nonstop. Get your hormones balanced with a hormone doc that's savvy in what they're doing, and get out and walk. Eat smaller meals, have a smaller Scarlett O'Hara waist, and enjoy yourself. Because when you're laden down with more weight, it's not a good feeling. The other thing I wanted to talk about was we have a rise of colorectal cancer, definitively. So that's cancer inside the gut and also the rectum, so it's called colorectal cancer. So much so that the age of screening with a colonoscopy has classically, historically been at 50 years old. But we're seeing more and more younger adults be diagnosed with later scary stage colorectal cancer, even before those screening years. So they're calling for earlier screening because this disease is on the increase. So this article came out in the Internal Journal of Surgery, and it's called The Risk of Colorectal Cancer with Hysterectomy and Oophorectomy, a Systemic Review and Meta-Analysis. And they talk about how common colorectal cancer is. It's the second most commonly diagnosed cancer worldwide in women. Yet, estrogen and progesterone play a very protective role against getting colorectal cancer. And when we become menopausal, we have less of those protective hormones. And if we have a hysterectomy, even if it's a partial hysterectomy and you leave your ovaries in, you still make less. And then if you got your ovaries out, of course, you still make less. Prospective studies have revealed an 80% decrease in estrogen levels after a hysterectomy if both of your ovaries are removed. And there's even 30 to 40% reduced estrogen levels, even if your ovaries are left in. And a lot of women don't realize that. Because once they've gone in surgically into your abdominal cavity and they examine your ovaries and so forth, they never quite function exactly optimally again. So in this study, they showed that the risk of colorectal cancer was increased 30% for women who got a hysterectomy and their ovaries removed. And if they didn't get their ovaries removed, there was still a 24% increased risk versus women who never went through any surgical hysterectomy at all. And the risk of colorectal cancer after hysterectomy increases with age. So if you've had any kind of hysterectomy, it makes a lot of sense to talk to a hormone doctor to look at your hormone level, at replacement, to protect your colon and your rectum and your satiety center and your portion control, as well as your brain, which we're going to get to your brain at the end, even though it's at the top of the body. So the risk of colorectal cancer is increased if you've had any kind of hysterectomy, and of course, even more if you've had a hysterectomy where both ovaries have been removed, which is an oophorectomy. So this is something to keep in mind. And a lot of times women come in let's say they were young when they got a hysterectomy and they just had a lot of bleeding or a huge fibroid, and they had a hysterectomy, and 2, 3, 4 years later, they did fine. And all of a sudden they've gained 30 pounds and they don't feel well. And nobody has had the conversation with them of the importance of replacing those hormones and how they affect the health of your colon, the health of your rectum, and the health of your ability to push yourself away from the table, as well as your brain. You know, there's been no study that has ever come down the peer-reviewed, placebo-controlled track that has shown brain protection as much as estrogen. These studies came out of Cache County, Utah. They were a set of prospective studies. So they started with about 8,000 to 9 to 10,000 healthy people in their 50s, mid 50s, had no health issues, had no cognition issues. And they tracked these people into the future. So that's called a prospective study. And they tracked who got Alzheimer's disease or cognitive decline. There's a variety of cognitive declines, from Lewy body disease to Parkinson's disease to Alzheimer's disease, but who started losing their wits. So we used to worry about the big C of cancer. This is the big C of cognitive decline. It is a big worry because we don't want to outlive our wits. And they discovered that if women had been on estrogen replacement for at least 10 years, she had almost a 50%, depending on the study that was spun off. There were about 50 different papers spun off these Cache County study. And some of them say a 30% protection rate. Some say up to a 50% protection rate. So there were a variety of studies. But women who'd been on estrogen for a hunk of time tended to not get cognitive decline. Estrogen helps maintain the volume of your brain, particularly of your hippocampus, where your memories love to live. Being young is all about volume. Size matters. With youth, size matters. And you have thicker collagen, and so you look brighter and healthier and younger, and you have thicker brain matter, so you can speak more fastly and remember things and really have, you don't have to, I was thinking when I was sitting with Neil and Jennifer, she's a bit younger than me. She was searching for some words. She said, I notice you're not searching for any words. I'm searching for some words. She just hit 60 and she still hasn't gone on hormones. She said, well, I don't go to any doctors. I have some resistance against this. I said, read my book, Safe Hormones, Smart Women, because it explains why hormones and keeping them safe even as you age is more important than food. It's more important than exercise. You eat well so that the nutrients you digest from your food can work at the binding domain so a hormone can nestle on into its binding domain and deliver its signal, because hormones are the most powerful signaling molecules we have in our body. We have all these elderly in nursing homes sitting in lines in wheelchairs with gray hair, with their head back, snoring and unable to communicate because their brains have shrunk. And if we gave them hormones when they hit menopause, we would have much less of these people rotting away and wasting their lifetime in these chairs in these nursing homes. In socialized medicine countries like Finland and Iceland and Norway, they give women freely, when they enter menopause, hormones for replacement, because they know they will protect their citizens and they will burden less their healthcare system, because hormones keep you younger longer than anything else. So I was saying to Jennifer, you got all this trouble to grow all this food and cook all this great food. If you're not taking hormones, that's, she said, what is it? I said, that's that. She said, what is that? I said, it's silly. It's silly. You're my dear friends. I want you to be communicating with me as we both grow older. Please go read my book and make a cogent decision while you can. So hormones have a lot to do with the volume of your brain, the veracity and bling of your cognition, your ability to stay who you are, the essence of who you are as you your hormones wane, the essence of who you are, it wanes. Don't do that. Why would you want to do that? Don't do that. Of course, health is it's a tapestry of so many things you do. People go, what do you do? What do you do? You want to know everything you do. And it's a compilation of things that you do. But the foundation of that are hormones. It's hormones. So please, there's 3 to 4 randomized controlled trials going on right now of COVID and hormones. And one of the reasons women are more protected from hormones is because estrogen is very protective of the immune system. And now I'm going to go into one of the specific estrogens that drives this home a little bit. So there's at least 60 different estrogenic acting molecules in the human body. And there's 3 major estrogens: estradiol, estrone, and estriol. Everyone says there's always 3 estrogens, but there's a lot of estrogen acting molecules. It's a bit more complex than that. But estriol is kind of a forgotten estrogen. Most hormone replacement is with just the most politically correct dual acting estrogen, estradiol. We often forget about estriol. And it is approved by the FDA for treating menopausal symptoms. And it is being looked at for a variety of ways, even in women who are fearful of taking estrogen, and even in unusual scenarios medically, such as reducing relapsing rates in women with multiple sclerosis. It is being looked at as a treatment for multiple sclerosis. In fact, I have a patient that I've been tag teaming with a Scott Baylor White team in Dallas with MS, and she's now on estriol along with a few other things, and her flares are greatly reduced, and they're reduced from several horrific weeks to 1 day. A lot of that has to do with estriol. Why? Because estriol is so powerful for the immune system. In MS, the immune system begins to eat away at the protective covering of nerves in people with multiple sclerosis. And this leads to all kinds of symptoms related to degraded communication between the brain and the rest of the body. And most people with MS experience symptoms that partially or completely improve, only to come back later with a relapse. But estriol plays a strong role in protecting the central nervous system during pregnancy, because so much is going on during pregnancy, and the mom is building a whole nother human being. The mom has to protect her own nervous and immune system from this new baby that's coming in. So the estriol binds to the estrogen receptors in the immune system in the brain and the spinal cord. And this pretty much helps protect the mom from the whole unfolding of pregnancy. And many women with MS tend to go into remission during pregnancy because more estriol is made during pregnancy than in any other time in a woman's life. The fetus and the placenta make huge amounts of estriol. So estriol is very immune system protective. So we think if you're going to be on hormone replacement, you ought to put some estriol combined with estradiol in it, because you're going to be protecting your immune system. So if you're out there right now thinking it's a good thing I'm on hormone replacement because COVID is here, make sure that you're on biest, which means you're on estradiol. You're on 2 estrogens, estradiol along with estriol. What are some of the other goodies that estriol can do if you're really afraid of estrogen because you still are of the old school of thought that estrogen drives breast cancer? Estriol cream applied intravaginally prevents recurring UTIs by reducing vaginal pH and improving the whole vaginal flora. So if you get recurrent urethral tract infections, urinary tract infections, you can dab a little bit of estriol on your vagina and your urethra, and it helps reduce, in many women, not all, nothing works for everybody, it helps reduce chronic recurrent UTIs. Now, as a woman ages, her urethra can get more constricted. And if you have chronic recurrent urinary tract infections, you can try D-mannose. You can look up D-mannose online, giving D-mannose prophylactically and treatment-wise, it can help treat recurrent urinary tract infections. But a lot of times it's just because your urethra is getting older and tighter and more constricted. And if that's the case, you can go to a urologist and they can mechanically stretch your urethra and then urethra that could help you reduce your number of recurrent UTIs. But why did that urethra be prone to constriction and contraction in the first place? Because it's a muscle and hormones have receptors on those muscles. And if you keep more estrogen going through perimenopause and postmenopause, you're most likely going to have a more flexible, facile urethra and not go through those problems. So hormones help keep flexibility even in your urethra. Now, another study of 206 postmenopausal women found 1 milligram a day of intravaginal estriol help maintain the youth of your pelvic floor and slow down urogenital aging, including even vaginal dryness. And one study showed that giving 2 milligrams of estriol just for a week helped treat premature early menopause. Another study showed that taking oral estradiol acts just like estrogen replacement for treating hot flashes, insomnia, and night sweats in postmenopausal women. So natural estrogen is very immune system protective. A 2017 review found that estriol is an important hormone to treat a lot of inflammatory autoimmune diseases. It helps reduce relapses of MS. It helps reduce pain and rheumatoid arthritis. I've used it now in multiple cases of inflammatory bowel disease. It upregulates adhesive protein in the lining of the gut, so it gives you much healthier gut adhesive capabilities, and less leaky gut. Estriol is the bomb. It's the bomb. And if you're just taking an estradiol patch or you're just taking an estradiol supplement, you're not getting the benefit of all the potential protective aspects of estriol. One study that came out in 2016 looked at 164 women between the ages of 18 to 50 who had relapsing, remitting multiple sclerosis, and they gave them one of the major drugs for multiple sclerosis versus giving it along with 8 milligrams of estriol daily. 8 milligrams, that's pretty high dose. And after a year, there was significant improvement in the MS group. So if you have autoimmune disease of any kind, you need to either speak to your physician about the adjunctive care of hormones or also go to a hormone doctor and have the two of them in some kind of dialogue if they're willing to do that, because you don't want to age or face disease without having estrogen be watching your physiologic back. You can get a little breast pain if you take too much. You can get still a little endometrial hyperplasia, a little extra overgrowth in the lining of the uterus. So it's still an estrogen. It's not like it's not an estrogen. And if you are still breastfeeding, it can reduce the production of milk. So there's some little ways to take a look at. Everything needs to be done with someone who knows how to do it. So just keep that all in mind. And there's also some drug interactions with some hormones. So some anticonvulsive medications can boost estrogen metabolizing enzymes. So you burn up the estrogen you take faster. So if you're on anticonvulsants and you take estrogen, you might need more because those medications might make them run through you more. There's some herbs. St. John's wort is a tricky little herb because It also can boost enzymes that process estrogen. And if you're taking St. John's wort, you might need to get a little bit more estrogen, whether it's estradiol or estriol, than you would have thought, because St. John's wort makes your body rinse out estrogen quicker than if you weren't on it. Estriol, by the way, can also increase the effects of some other drugs. So there is a give and take here. So it can increase the effect of corticosteroids. So I only have one adrenal gland, and every now and then if I'm stressed out enough, I need to go on a little bit of hydrocortisone. But I don't need to go on the amount I used to need to go on because now I'm on estrogen replacement. So estrogens can affect corticosteroids, theophylline, and also a number of other medications. So you always want to take a look with anything that you're on to see the potential interactions of anything. And almost every single drug uses up some nutrients. So when you do take estrogens, you need more B vitamins, more magnesium, more zinc. You need a lot more nutrients because all those nutrients are used in allowing estrogen to do its signaling. So if you are on estrogens, if you are lucky enough to have a physician that's testing and balancing and treating your estrogen so that you can successfully stay younger longer, yes, you want to make sure you're taking a multivitamin mineral so that some of the nutrients being used up by processing those estrogens will still be all okay for you. So that was a lot that we talked about tonight at the end of a great, sunny, beautiful day in Austin, Texas. What a time. There's going to be 11 Republicans that are denying the electoral read, and the president right now is calling on people to, on Wednesday, fight against the electoral vote. We live in such a chaotic time, but when in life has it not been chaotic? Maybe 3 days and 52 years ago. It's always been chaotic. It's always going to be chaotic. So let's get our hormones and our attitude and our community on straight and make as good fun with as good protection and as good community and as good days as we can have, because life is always like this. It's a crazy ride. But we're here to help you be a better agile thinker and think of things that can make you be less afeared and have less learned helplessness and more proactive sense of power based on peer-reviewed science and a little bit of mirth and glee delivered from thee. I didn't plan that, but it just came out like that. Well, have a great week, and we'll talk to you once again. Bye-bye.